Check 1 2 1 2 check 1 2 1 2 1 2 1 2 3 4 1 2 1 2 check 1 2 3 1 2 1 2 1 2 1 2 1 2 check 1 2 1 2 3 4 1 2 1 2 check 1 2 3 4 1 2 3 4 check 1 2 1 2 1 2 1 2 1 2 1 2 check 1 2 3 4 1 2 1 2 1 2 3 1 2 1 2 1 2 check. Good? Cool.
Good morning, everyone. I was waiting on my board chair to arrive, but apparently she's running a little bit late. So we are going to go ahead and get started. Just wanted to welcome you all. Oh, I should probably find my notes because that would help. Welcome to our 2016 Funding Innovation Forum. Most of the time we host a conference to explore new ways of thinking about innovation. But where we've received the best feedback is more in this kind of a setting where we do a very brief 2 hours, tell you about what we've done in the past and a little bit about the reasons why we funded those particular projects. And that would seem to be much more favorable to a day-and-a-half conference trying to learn about innovation. Let's just talk about what we've done, and hopefully you gain some nuggets of information from that. Since my board chair isn't here yet, and I am going to introduce our past board chair, Rob McCrae. He doesn't look like this. Rob has been on the board for several years. He is the CEO of the Wireless Life Sciences Alliance, so he brings a lot of that experience to our board. But I would like to welcome him so he can welcome you guys and tell you about our innovation initiative.
Okay, you know, I was at the La Jolla Playhouse for the Second City last summer, or 2 summers ago, and I got pulled out of the audience into a skit about a gay marriage. So this isn't quite so awkward, but I did not prepare anything. I'm sorry that Elizabeth can't be here because she took over as chair about 1.5 years ago. And, you know, we started this innovation initiative and kind of revamped Alliance Healthcare under my watch about 6 years ago. And we have been learning, as you have been learning with us, and our students and teachers are here on this floor. So we're all going to learn together. But what we're looking for is how to put our funds that have been entrusted to Alliance to the best use to improve and support the health and well-being of the challenged, needy populations of San Diego and Imperial County. It's as simple as that. We're looking for the best ways to put our money to work. We have a number of different programs. I think Nancy will review all that. You probably all know about those anyway. But this innovation initiative each year has been our biggest single program on an annual basis. And so it's very important to us. We learn from it. We're trying to get better at it. And find the best organizations and people here in the area to use these funds, and then to help them once we make the initial grant to be successful. And sometimes those programs continue to be supported under an additional program we call Invest Up, where we actually use a portion of our capital that would otherwise be invested to give us the returns that we have to live on and make next year's grants. But we have an Invest Up program where we actually will invest more into programs that we really think can carry out this mission for us, that is supporting the health and well-being of people of the region. So we've been entrusted with the money. We are doing our best to put it to work. And I thank you on behalf of Elizabeth, all the Board of Trustees, a number of whom are here. Joe Ramsdell is here. Rosemary Johnson is here in the back. Do we have other trustees here? In any event, I want to welcome you on behalf of everyone to be here. And Nancy? And Elizabeth is there.
So my notes say to say thank you, Elizabeth, but fortunately I can ad lib and say thank you, Rob, for stepping in at the last minute and doing the welcome and telling you a little bit about Innovation Initiative. Rob mentioned our Invest Up strategy, and he actually chairs that particular committee, which is a committee of the board, as we look at what, and putting a framework around it. You haven't heard about it probably, because we're really putting a framework around that to see what that looks like, and then we'll tell you more about it. But we are looking at how we might be able to put more funds out into the community to make a bigger impact, to have a legacy and long-lasting impact in our community, to improve the health and wellness of the people that we serve. So look forward to that. As part of our iEngageU, this is one of the forums that's part of our iEngageU forums. And that's not only just iEngageU, but it's you engage me, but it's also you engage you. And it's an effort for us to begin to have the community engaging each other in what you're doing and the work that you're doing. And this is one way that we hope to let you know about some of the work that's happening in our community. So welcome to you all. We're doing this format in something that's called a Pacheco-Cha. And I saw this a few years ago. And a Pacheco-Cha is where you get 20 slides and they advance automatically every 20 seconds. And so you have to time your presentation and the words that you're doing for 20 seconds because the slide's going to advance on you. The thing is I've never had to do that, right? This is just in case y'all don't know who I am. I'm the executive director of Alliance Healthcare Foundation, but I'm so nervous about now I have to do the PK. But anyway, so now I get to practice what I preach and do my own PK, so wish me luck. I'm going to talk a little bit about OneEApp and Text for Baby, which are two projects that hadn't started yet, so the timer's not on. I'm going to talk about I know, right? It's like I still get to ad lib. It's okay. It's okay. Hey, I'm the executive director. Didn't you see that slide? I get to cheat. But I'm going to talk about OneEApp and Text for Baby because they were two projects that we started off with the Innovation Initiative. But I'll tell you more about them in just a minute. Okay, deep breath. You ready? Here we go. Right? Okay. The Innovation Initiative started in 2010 in response to community concerns about the impact of the Affordable Care Act. Not enough physicians and mid-level practitioners being inundated with patients, many of whom had not had a recent health care checkup, and low reimbursement rates. As I talk about the first two projects, I'm going to talk more about how we partner with the projects and a little bit about their accomplishments. The board launched the Innovation Initiative in 2010. They were seeking projects to address the systemic changes that were needed to address these concerns and would reduce cost, increase capacity, or improve quality. If you had $1 million to change healthcare for the underserved, what would you do? Each year, the program committee reviews the applications and selects 5 to present. That first year, we funded 2 projects, OneEApp and Text for Baby. OneEApp was being developed in other parts of the state and enabled organizations and individuals to complete applications for all benefits programs, for the individual and for all members of their family. Text for Baby was creating a way to send text messages to low-income pregnant women in hopes of improving pregnancies and birth outcomes. The primary interest here for us was to test the ability to use text messages for health education purposes. Back then, which was just 6 years ago, text messages hadn't been used in this manner very widely, and especially free text messages. Let me start with OneEApp. The original grant objectives were to increase the number of programs in OneEApp, implement a self-service version, develop new mobile technologies, and involve stakeholders and partners in the business-to-consumer version. In the process of implementing this project, there were many examples of how we work with each recipient to get the best possible outcome. Recently, I compared this project to my volleyball game because you go to the beach thinking that you're going to play, let's say, 6-on-6 like the left, and when you arrive, there are only 4 people, so you're really playing 2-on-2. It's a different game, and that happened with OneEApp. Originally thinking there would be a broad range of benefits programs included, some decisions were made that limited the number of programs. The impact of this change meant that we didn't have the strongest volleyball server on the court. That really changes the game. As a foundation, we are in close contact with our grantees and work with them to design new strategies. And when they changed the ball, literally changed the ball, you're supposed to keep your eye on the ball and they changed the ball. OneEApp, that happened to OneEApp when they changed to charging fees. But no worries, we can find a champion or at least an organization that can take this project and make it work. And then someone comes in and takes over part of your court to play over the line. In this case, another application project was started. After 3 years of funding, the project ended. OneEApp was the catalyst for bringing over-the-phone enrollment here. It improved access to public assistance programs and established sustainable funding sources. Specifically for 211, they became experts in over-the-phone application assistance with the ability to obtain an electronic signature. This led to a contract with Covered California. And during the 3 years, OneEApp integrated 3 new programs, enabled 4,000 self-service applications, and 211 alone submitted over 17,000 applications with 10,000 of them being accepted. This brought in $16.8 million in client benefits and over $30 million in economic stimulus to San Diego County. Text for Baby was another project that was funded in 2010. Okay, no volleyball analogies, but it didn't go as planned either. What we knew at that time was that 79% of Medi-Cal beneficiaries were texting. The average person looks at their phone once every 6.4 minutes or 150 times a day. And low-income Americans text more than higher-income American adults. 99% of text messages are read, and 90% are read in the first 3 minutes. Hey, I'm not supposed to be there. What happened? But just knowing that isn't enough. A randomized evaluation by George Washington University, I get to make up the rules too, that text for baby mothers were 3 times more likely to believe they were prepared to be new mothers compared to the control group. Okay, back on time. Research specific to San Diego moms indicated that 74% were more informed about warning signs, 67% talked to their doctor about a topic they received in a text message, 65% were reminded of an appointment or an immunization, and 40% reported that they followed up with a service or phone number in a text message. The original goal was to enroll 18,000 women. When I came on board, they were far short of that goal. All 3 of the original leaders of the project had left their respective organizations so that new leadership with the San Diego County Medical Society Foundation was needed to continue the progress. Eventually, a dedicated staff person was hired to promote Text for Baby locally when it became clear that we needed that kind of champion. In a few months, it became clear we could work with our local partners forever, but in order to integrate the practice into current practice, more was needed. Locally, First 5 was an early adopter and included Text for Baby in its contracts. Additional funding was provided by Alliance in order to work with the state funding sources to incorporate Text for Baby into their contracts. The first was maternal and child health programs. The next was Medi-Cal, to ensure that Medi-Cal moms were receiving more resources that were applicable and relevant to them. They partnered with Covered California, and they also expanded to Medi-Cal to manage care plans, CalSim as a best practice, and the Department of Health Services for quality improvement. They have now added a Quit for Baby. They've also added a new app. One complaint was that the text services limited the information that could be provided, so the new app can do so much more. There's a timeline for weekly health and safety information that tracks the baby's development, has a to-do list, and polls on pregnancy symptoms, infant development, and emotional experiences. As of March 19th, California has 90,000 users since the launch in 2010. That's us as the big column, since you can't read it. To recap, we partnered to develop new strategies, worked with the new champion, provided additional funding to ensure implementation in contracts, and we also, now Text for Baby is now a part of the 0 to 3 national organization. So I hope that this has given you a bit of the perspective of the role we play in the life of an Innovation Initiative Award winner and how we will partner with them to implement and to be successful. I also hope that it gives you some ideas of the types of projects that we are looking to fund, and you'll hear more about that from our other speakers. That with those that are testing new ideas or projects, those that are improving access, reducing cost, improving quality, and/or increasing capacity. I hope that the next presentations will trigger your thinking, not only because of the project, but because a nugget within their progress will spur new thinking for you and your organization. If you had $1 million, what would you do? I did it. Whew, I don't envy you guys, right? But I'm going to take the clicker. So, no, I'm just kidding. Y'all get the clicker. So next, I would like to introduce to you John Ohanian, who is the CEO of 211 San Diego. Recently, our 2011 Innovation Awardee, the CIE, or the Community Information Exchange, merged with 211. So join me in welcoming John Ohanian.
Hey, I wasn't nervous until I saw that. Okay, everyone take a deep breath. Come on, you're not taking a deep breath. In, out. Nancy, you glad that you're done? Who's after me? Okay. Okay, here we go. Okay, on your mark, get set, go. Okay, thank you very much. It's great to be here to talk about 211 San Diego and the Community Information Exchange. And we do appreciate the support of Alliance Healthcare Foundation, as well as the leadership of Scott Beckler-Levine and other members of the Community Information Exchange that have been working really hard over the last few years to get us to where we are today. So where I want to start today is when people think of San Diego, they think of our beautiful beaches, they think of our great weather, our craft beer, and our Padres. Who was there at opening day? Anyone? All right, a few of you. But what you don't know is that San Diego County is actually a complex county. It's larger than 22 states, and it's not only diverse in its geography, but also in lots of things that go on here. The complexity of San Diego comes from many facts. We have one of the world's busiest borders. We have more than 100 languages spoken, 18 tribal nations, the largest military and veteran community, and a diverse geography, both urban and rural settings. When you think about it, you're all living here, so you know how diverse San Diego is. These complex issues drive 211. Our why, our purpose, is to make positive, lasting impacts on people's lives and drive meaningful change throughout our communities. Our why impacts our what and our how of what we do each and every day. So over the last few years, we dug deep into our why and realized that we could do better. We know that we can do more than just connect people to phone numbers or services or provide information. We realized that our community needed 211 to be more than just a basic information and referral service. And that realization led us to build an enrollment service. And we partnered with our county, our community partners, and pioneered telephonic signatures to required to apply for public benefit programs, as you heard Nancy talk about. And we're really proud that since its inception, we've submitted more than 30,000 applications for CalFresh, Medi-Cal, and Covered California. But then we started asking ourselves, what happens to our clients after they get their benefits? Are they getting the care they need? So we initiated a health navigation program focusing on care coordination. Our team works with clients to better connect them to services and empower them to take their health into their own hands. And we've done the same thing with our Military and Veterans Services Department. We're honored to answer Courage the Call, a peer-to-peer helpline offering navigation and care coordination to active military and veterans and their families. This program is a great example of collaboration with Mental Health Systems and Veterans Village of San Diego. In each of these experiences, we see that when individuals or communities are facing a crisis, it's a live human connection that they need. So whether it's firestorms, El Nino, H1N1, 211 has always been there and will be there to respond. Using Live Well San Diego as a vision for our community, we at 211 align our strategies to the 3 key areas that improve clients' health, safety, and the ability to thrive. And while those are big, audacious goals, it all begins with serving one client at a time. The word person-centric is used a lot today. You might see it at your bank or the last time you bought a car. We see it as a way to improve quality, reduce costs, and most important, provide excellent service to our customers. Our own county of San Diego is building a person-centered record as a way to enrich the lives of individuals and families through collaboration. The system's called ConnectWell SD and will be fully implemented by December 2016. And the first pilot is actually starting next month. Today we have Dan Chavez, Executive Director of San Diego Health Connect. In our health community, San Diego Health Connect has over 3 million people identified and over 2 million people opted in to the Health Information Exchange, which allows doctors and hospitals and other providers to access the right information at the right time so patients receive the right care. Thanks to the longtime support of Alliance Healthcare Foundation, which supports the Community Information Exchange through its Invest Up strategy, our community's what if is becoming a reality. Started as a unique partnership, the CIE has piloted and proven that care coordination is not only wanted, it works. The combination of 211 and CIE will power an exchange of information among nonprofit providers, beginning with closed-loop referrals, warm handoffs, and a sharing of information. We will assist clients in meeting their social determinants of health by ensuring they are well coordinated. Our long-term goal is a community-wide regional information exchange, bringing a strong partnership of trust and relationships. Leveraging each other's strengths and technology, we can create a true ecosystem of care. And I hope when you see this picture, you see all of you and how we can work together, because 211 and CIE can't happen without the community partners. Built on the principles of collective impact, this regional information exchange can provide enhanced care coordination, reduce costs to provide services, and improve the quality of care, which is why we're all here. Working together, we can continue to improve our population's health, one person at a time. Who here has heard of open data? As our community moves towards more open data environment, we plan to work on projects to identify trends, service gaps, and unmet needs to improve service delivery and create new resources. Imagine if all of you had access to this data today. How would you use it? So I constantly ask our team, how are we going to do all this? Areas like privacy, consent, security, interoperability, and if that doesn't scare you, how about change management? We're going to all be on a journey of learning new ways to help our clients. And the foundation is trust and relationships. For over a decade, our why hasn't changed the 2-on-1, but our hows and our whats continue to evolve. Because as Simon Sinek said, what you do is proof of what you believe. And on behalf of 2-on-1 and our CIE team, we will continue to work hard to prove what we believe. Thank you.
Good job, John. Thank you. I know, right? Now you can have that drink of water. You know, it's like, what time? Anyway, when we first worked with CIE, they came to us really as just a concept. And we were really excited about the concept in 2011. Our first step to working with them was to say, here's some funding, go out and establish your governance, go out and establish your infrastructure, go out and hire an awesome executive director like Scott to make this project actually work, and we'll continue to fund you. So that was, a lot of that is just an example of, it was this concept that we really believed in. And it's so exciting to see where it's come to today, that it's come to fruition. It is now one of the project that we've provided the most funding to at $2.5 million to get this off the ground, to get it to this place, and to get it to now connecting with 2-on-1 in the way that John just described. So it's just another example of how you don't know what it's going to look like when it starts. We believe in it, but we'll continue to work with you to help you bring it to succession. To be successful, I think that's really what I meant to say. Anyway, so next I would like to introduce Dr. Amanda Tucker with our UC San Diego Wireless Observed Therapy Project. So Dr. Tucker.
The start button, is this the red?
If you need to, if you want to get it started. You ready?
Well, in a minute. Morning, everybody. It's great to be here. Just briefly wanted to say I'm presenting for Dr. Sarah Brown. She's recovering from some surgery, but I work with her as her lead coordinator and project manager, so it's nice to be able to present the study to you.
Ready?
So thank you. Yeah, I'm ready. Thanks to the generous support of the Alliance Healthcare Foundation and the collaboration of the County of San Diego Health and Human Services Agency, we at UCSD are able to continue enrolling tuberculosis patients into a randomized controlled clinical trial using a novel technology to remotely monitor TB treatment. Tuberculosis is an enormous global health problem that disproportionately affects the underserved. Mycobacterium tuberculosis infects 1/3 of the world's population and kills 2 million people a year. In most cases, tuberculosis affects the lungs, but it can invade almost any organ of the body. When an infectious person coughs or sneezes, he sends minute particles of sputum into the air, exposing anyone nearby. For many years, the disease was referred to as consumption because without effective treatment, people literally wasted away. Poor adherence to therapy has long been the recognized barrier to effective treatment of tuberculosis infection. The need for improved genomics, rapid diagnostics, improved drug supply, and new TB medication have been addressed, but without effective treatment monitoring, treatment of MTB will never be successful. Inconsistent and interrupted treatment in combination with HIV co-infection has led to rising numbers of TB cases and the emergence of drug-resistant TB, with alarmingly high rates in Mexico. As we live on the border, TB control is vital to health in San Diego. The World Health Organization states that tuberculosis should be treated with directly observed therapy, DOT, where the healthcare worker watches the patient swallow their medication. Studies show that 86 to 90% of patients receiving DOT complete therapy, compared to 61 of those on self-administered therapy. However, while highly reliable when performed appropriately, DOT is resource-intensive, time-consuming, and represents the largest single cost to TB treatment. A critical barrier to the field of medication adherence is the inability to definitely confirm medication ingestion. Proteus Digital Health have developed an edible sensor to provide wireless observed therapy, WAT, as a reliable, efficient, and cost-effective alternative to DOT for sharing complete and accurate medication data in real time among patients and their healthcare providers. The randomized controlled trial, WAT compared to DOT for MTB treatment, led by UCSD and funded by the Alliance Healthcare Foundation, is based on the use of the first ever edible sensor to wirelessly confirm ingestion of TB medication. The collaboration brings together academia, industry, and public health care. This novel WAT technology provides date and timestamp recording of medications, ingestions, via ingestible sensor and monitor patch worn on the patient's torso. Ingestion data is transmitted to a paired mobile device and uploaded to a secure server. The ingestible sensor is the size of a sesame seed and consists of an integrated circuit coated with thin layers of metal and minerals found in the daily diet. Once ingested, it's powered by the conductive environment in the stomach and sends a specific identity code to a paired patch worn on the patient's torso. And since the study was initiated in 2013, there have been various upgrades to this technology, making it more, improving functionality and usability for patients. The next 3 slides describe the WAT technology onboarding process. This slide shows the sensor-enabled TB medication being prepared by our investigational pharmacist. She's combining the ingestible sensor with rifamate, which is a combination of isoniazid and rifampin, into a gel capsule. The next slide shows the study coordinator, and this actually isn't a real patient, it's one of our staff, onboarding a patient onto the technology, showing him how to pair the patch with the app on the mobile device and how to correctly apply the patch to the left side of the torso. And here we have her showing him and giving direction on exactly how to use the technology. And most of the patients aren't tech savvy, but it's very easy and very user-friendly. The patch is worn 24 hours a day and has to be changed every 5 to 7 days. So this WAT technology is capable of detecting multiple ingestions and physiological data, including activity and heart rate. It provides near real-time adherence monitoring and provides feedback to patients on their performance with future prospects of near real-time intervention and support of medication adherence. So here we see the specific details of the rifamate being recorded, showing us the exact date and time of the ingestion. So this, and you can see the pattern of ingestion taking. Here we have a map of San Diego and Imperial County, a vast area covered by only 8 public health nurses and 8 DOT workers. By participating in this study, many underserved TB patients have enjoyed the freedom and flexibility that WAT offers. The ability to take their medication at a time convenient to themselves while still providing accurate medication monitoring. And a good example is of one of our participants is a domiciliary hospice nurse. Prior to enrolling in the study, he was having to attend the TB clinic on a daily basis to have his medication recorded, which was clearly stressful for him. So that the use of this ingestible sensor technology can ultimately impact tuberculosis treatment globally, providing a reliable new method of TB therapy monitoring and hence support many more patients worldwide. This would mean better treatment completion rates, less drug resistance, and consequently less cases of tuberculosis. Thanks very much.
Thank you. Thank you so much, Dr. Tucker. Dr. Tucker is actually also seeing patients today, so that's why she needs to leave us. And although she didn't seem like one of those real kind of rule breakers, did you notice she went over time? Like, wow, that's pretty incredible. Now, this project was something that was really interesting because we typically do not fund research. But we were excited about this particular one because not only was it doing research, but it was also had the implementation phase of it and working with the public health department and the TB clinic. So that combination was what was really exciting. Not only were we testing a new product, but we were the thing that was most important was that is implementation in the public health department, reaching the population that we're trying to serve. Next, I would like to introduce Renato Paiva. He is the Executive Director of Access Youth Academy. So help me welcome Renato. Is this one your first slide?
Yep.
Okay, so when you press that button, it's a go.
And if I want to fast forward,
Well, just use the clicker.
or don't do it at all. Got it.
You just use
Okay.
the clicker. That's what I did.
Okay.
Okay.
Before I start, this is hard for a American and English speaking. I'm a foreigner, so maybe it's very much complicated to do this. So here we go, a second language. Here we go. Doing Portuguese. Here we go. There's two Brazilians there that can do this. Access Youth Academy is a youth enrichment program based here in San Diego that's transforming young lives. We've been in operation for 10 years, and we serve currently over 100 students in several schools here in San Diego. My name is Renato Paiva, and I am the ED for all the 10 years that have been in existence. By my accent, you can see that I am from Brazil. And prior to be working here at Access, I was a professional squash player, and I was a coach at Harvard and USC, which gave me the background to talk a little bit more about squash. Access Youth Academy is based in 4 pillars. The number 1 is academic achievement. Number 2 is health and wellness. Number 3 is leadership. And number 4 is social responsibility. All this is based on the innovation of using a non-traditional sport of squash and to help these young students here in San Diego. We use it as a platform to do our work. Why squash? I can go on and on about this, but I can say that squash is a great sport to get into college. Is the biggest odds you have to play sport and go to college is through squash. Also, a lot of great network. Usually who plays this game usually comes from a great background and is a lifetime sport. My board chair, Blair Sadler, is 75 and we play each other twice a week. The urban squash movement has been going on for 21 years, started in Boston. We were the 6th program and the first one on the West Coast. I'm proud to say that there are 5 international programs, South Africa, India, Colombia, Canada, and my own Brazil. Last year, I went back to São Paulo and I started the urban squash program in São Paulo, and we have in attendance the new ED straight from Brazil for you guys. Squash accomplishment within Access, we've been in operation for 10 years, and we've won 13 national titles. Most of our kids play college squash, so they still carry on playing the sport. And above all, just to give an example, at Berkeley, the female varsity team, we have number 1 through 5 from Access. So very shortly, we're going to call Berkeley/Access. We have very strong links in the community, in our community service programs. We have served in the 10 years thousands and thousands of hours with the community, partnership with the Hunger Project, community gardens, and so forth. We have a 12-year promise. We have the first phase is 6 years from 7th to 12th grade. Second phase is a college phase, and the third phase is 2 years post-college. So let me say this one more time. We have a 12-year promise with those students from the 7th grade to 2 years post-college. We have kids going to all those schools and many more, a bunch of Ivy League schools. We're very proud of our accomplishments. We have 100% graduation rate from high school, 0 dropouts from college, $4.5 million in scholarships, and we keep growing. We just got 2 kids into Berkeley last week. Innovation. We want to go to our second chapter of Access is to put this pilot program, which is no longer a pilot, 10 years, to scale. We want to go to a neighborhood where we can have a bigger impact. We've been working with Hoover High and Monroe Clark in City Heights, and we've been expanding our pilot program. This facility is going to have a much larger footprint. Our new campus will have 10 classrooms, 9 squash courts, and many other rooms they can use for the community. We're going to be able to serve 150 students per year in our comprehensive program and 1,300 students in our PE program. One day I marched into a board meeting and said, folks, we're going to put our program where they live, and the board loved it. So the idea was to avoid the problem of transportation. Currently, the kids take 2-3 buses to see us. So we're stopping that. 2013, Alliance believed on us, and they said that we're going to work together. And I really must say the Alliance in this past 3 years pushed us to enhance and get us better. From board to programming, pushed us on how to diversify our board, pushed us how to enhance our pilot program, and the collaboration and thinking with Alliance was very impressive. I can say today that we're much better nonprofit due to them. Innovation does not come without hard work or bumps on the road. I guarantee you that, because we've been having our struggles. Usually our problem has been with location, where to put this facility, and I am very happy to say, without jinxing, that in the next 60 days we may have a place to go, and that's very exciting because it's taking 3 years to get there. If I do this, I get there? No. Here we go. Our staff is diverse. Our board of volunteers are very strong, and we have an army of volunteers and mentors. We have 13 nations represented with our kids. So we believe that diversified staff and board can really help them accomplish their dreams and their goals. Access believed in us, and this belief has really helped getting students like Reina Pacheco. Reina is a 4'11" girl from City Heights. She was a gang member when she started with us, and she spent 6 years training every day, studying every day, and now she's at Columbia, actually graduating in 4 weeks. She won 9 national championships, and she played #1 for Columbia. This little girl won 9, started from Columbia. She had decided to become a professional squash player, and she's number 78 in the world today, which is kind of crazy. I keep saying a volleyball analogy. Squash in San Diego is beach volleyball in Alaska. Doesn't make much sense. For the past 10 years, we've been serving over 100 students, and with this new facility, we're going to serve over 1,000 in our first year. We're very excited. It's our 10th year anniversary. It's a big year. October 22nd, we have our big event, which will kind of ramp up the year. We're really excited. We're really thankful for Alliance. And I'm very happy that my English made it through this presentation. Thank you very much.
Are you kidding me? That was awesome. So on its surface, this was one of those projects that we talked about quite a bit, because on its surface, it looks like it's a squash program to get in college, right? But what was really exciting for us as we looked at this one was that it was really so much more than that. This project really began to move us into a conversation about the impact of social determinants of health. Where you live matters. And it showed kind of the impact that can happen in a community, because we all know that if your parents went to college, the likelihood that you're going to go to college, or the kids of those parents are going to go to college, is greatly increased. So what we could see was that by helping these students get to college, we could have a longer term impact in City Heights, especially to further that community, to have it be a more prosperous than it is today. But that was, so on its surface, it looks like something different, but the innovation was using squash as a method of actually impacting social determinants of health in City Heights. What's also kind of cool about it, he talked about the one student we did get a chance, I've had a chance to meet her, but you also hear the stories about once they see their sister or their cousin going through AYA, they say, oh, I could do that. They begin to see that there's a different future for them, and that's very exciting to see. So next we are going to welcome to the stage Chris Megason. Did this change? It did. It's there. Okay. We're going to welcome to the stage Chris Megason. He is the CEO of Solutions for Change.
Good morning. I've done a few of these and have messed up every one, so I don't anticipate that this will be any different. But you never know, because it is trailblazing is innovation, and eventually you get it right. So where's my clicker? There it is. The mission of Solutions for Change is to transform lives and communities permanently, solving family homelessness. Our approach is unique, providing a complete and sustainable solution driven by accountability. This model was created when the founders walked into a shelter and saw homeless families and said, no more. Solutions for Change began as a small local operation in Vista. The three pillars utilized to achieve this mission are Solutions University, Solutions Enterprise, and Solutions in the Community. These pillars combine to create successful, sustainable solutions for families and the San Diego communities in which they live. They have solved homelessness for 800 families with over 1,500 children. I'm going to focus primarily on Solutions University and Solutions Enterprise as they relate to the innovation initiative. Solutions University transformed lives in 1,000 days by equipping parents with the skills, knowledge, and resources they need. Solutions Enterprises includes Solutions Farms. For those we serve, getting a job and keeping a job seem to be the critical piece for success. Solutions approach meeting this need in a very unique way. We pioneered the nation's first leadership academy for the homeless, with emphasis on developing the core character strengths needed to succeed in today's workforce. How would we meet this huge need? The answer was to trailblaze an aquaponics farm. You might ask, how does an aquaponics farm solve homelessness? How does putting seeds into trays make a difference? How does ensuring a chemical-free, disease-free environment contribute to success? You will be surprised. They all combine to teach important life and leadership skills. What is aquaponics? Aquaponics is an innovative new farming method that combines aquaculture and hydroponics to create a single symbiotic ecosystem where both plant life and animal life can thrive. At Solutions Farms, tilapia and baby greens live in a mutually supportive environment where the baby greens thrive in the natural fertilizer from the fish, and the fish enjoy clean filtered water created by the plant life. By bringing Solutions University residents together to work toward a common goal, Solutions Farms fosters a sense of community and purpose, both key factors in helping to dig deeper into the issues that contribute to homelessness. By addressing these issues on a deeper level, while at the same time providing the tools to create a shift, Solutions Farms and University deliver life-transforming solutions. Many also find the nature of the work to be both therapeutic and meaningful, which the organization believes is a key piece of our success. For Solutions for Change, there are many solutions. Solutions University and Solutions Enterprises and Solutions Farms are truly making a difference. But there's more. What do we do with all those organic baby greens that we are growing? We give 10% away to those in need, like our families, but we sell the rest to other organizations. It's a farm to table, it's locally grown, and it's all certified organic. Vista Unified School District has contracts to purchase our baby greens, which mean thousands of school kids enjoy the freshest food. There are heartwarming stories about the impact of providing those greens to the Vista Unified School District. The children in the school love the greens. They even ask for seconds, which when I first heard, I'm like, there's no way they ask for seconds. I got a 17-year-old. Sorry, I had to get that in there. How many times do you hear that? Some of the students are children of the parents working in the farm and are able to proudly say, my mom grew those. Believe me, the parents are so proud to hear their children say that too. And here's where the Alliance Healthcare Foundation Innovation Initiative comes in. Solutions for Change presented an idea to expand the Solutions Farm, tripling in size, producing more organic baby greens and expanding their contracts with other school districts and organizations, including the districts all along the 78 corridor in North County. The balance cycle with the fish and the plants largely support itself. That means organic fertilizer, 0 cost. Dispose of extra waste, 0 cost. Water usage, 95% less than traditional farming. Electricity, almost 0. Social enterprise revenue development, priceless. Sorry, somebody got that in there. Aquaponics offers a highly sustainable way to grow this innovative social enterprise. Solutions Farms' humble beginning, growing organic baby greens, is quickly flourishing, blossoming into a viable social enterprise. The projections are to generate $300,000 in revenue annually. The revenue generated is then invested into programs such as Solutions University and Solutions in the Community. This award was a combined grant of $500,000 and a program-related investment, or PRI, of $500,000. The latter being a loan that was designed as an incentive for the social enterprise. It was also constructed so interest doesn't occur and payments are not required until the farm is in full production. While we were working on the details of the grant and loan combination, Solutions added a world-renowned aquaponics expert we brought in from Australia, as well as an expert in the hydroponics to our team. The result was more efficient use of the farmland, as well as more efficient production of an ever greater amount of produce, 30,000 more pounds to be exact. From this research, we used tubing instead of water beds to more efficiently grow our greens and maximize the use of the space. Starting the seedlings already in the tubes eliminated additional space needed for this process. The location of the larger fish tanks was also a critical component to the increasing efficiencies. I'll wait for this thing to catch up. Oh, I can advance it. That's right, I have control, okay. And going back to the Solutions University, new work opportunities were created with the expansion, construction especially, and some of the residents were hired by the company doing the work. Solutions for Change is working tirelessly to develop a replicable model of Solutions Farms in order to bring the vision of social enterprise to other communities in need. Solutions Farms is a thriving example of how powerful a force social enterprise can be for the families and the communities that we serve. Alliance Healthcare Foundation supports social enterprises like Solutions Farms because they advance health and wellness in their community, provide a revenue stream not reliant on government or philanthropic dollars, and serve the target population of the Alliance, which is 250% of poverty, children, and the homeless. Solutions Farms will be the largest aquaponics operation in California. In fact, it will be one of the largest aquaponics operations in all of the United States. But innovative farming methods are only a part of our impactful story. The real story is that with social purpose investors like the Alliance Healthcare Foundation, we are pioneering permanent and sustainable solutions that get to the root and solve family homelessness permanently. And that makes all of us stronger, and that makes all of us much more healthier. Thank you.
So that was an example of another way that we partner with our projects. I wrote most of that for him. So, well, it also shows how I do pay attention. You know, I go out there, I see what's going on, and I try to find out what's happening so I can keep up. But this one was also a very interesting project for us because it had so many different ingredients: healthy food, ending homelessness, and a social enterprise. We were excited to see the fruits of their labor, or maybe I should say the veggies of their labor, literally. But this project was, as he said, set up to be both a grant and a loan. The loan was set up in a way to encourage and support the social enterprise side of the project. So as Chris has shown, we are just entering into that next phase of the expansion and the tube kind of growing. Wasn't that kind of interesting? I'd never seen like those tubes. I'd always seen them in the trays. So I can't wait to come out there and see the progress that has been going on and to see where we are when we present this next year. So our most recent Innovation Initiative Award in 2015 went to Mental Health Systems and Mountain Health Community Services. So help me welcome Scott Sukow to tell you more.
Okay, thank you, Nancy. Hi, my name is Scott Sukow. I'm a Vice President for Mental Health Systems and the project lead for the Innovations Grant from Alliance Healthcare Foundation. This is a pilot in a partnership between Mental Health Systems, a provider of behavioral health services, and Mountain Health, a federally qualified health center. Our goal is to create a health home for those with serious mental illness, referred to as SMI clients in this presentation. In San Diego County, there are 40,000 SMI clients treated in 24 different mental health centers. The center in Escondido has been selected for this pilot. With the implementation of the Affordable Care Act and Medi-Cal expansion, the system is transforming. Currently, SMI clients get their mental health needs met in one location and their primary care needs met in yet another. In the future, many expect these clients to be transitioned to primary care clinics where they will also receive their mental health care. It is our opinion that this won't work for many SMI clients. This is why we partnered on this innovative pilot to bring full-service primary care into the mental health center, providing primary care in a familiar setting using peer support partners to coordinate care and allow for longer care visits with physicians to treat their chronic health conditions. This pilot brings two funding systems together: the county-funded mental health center and the federally qualified health center. The Innovations Grant from Alliance Healthcare Foundation funds the gap between these two systems. Before we go further, I want to share that for those living with a serious mental illness who are Medi-Cal recipients, their mental health is treated in a designated mental health center, such as our center in Escondido, our pilot location. The other segment, which is not this pilot's focus, are those living with mild to moderate mental illness. These clients are treated in primary care settings. A different approach is needed. I wanted to share a story of a client. I'll call him John. He has anxiety and schizophrenia. He does not feel safe in most places except at our center. Even there, John walks down the hall sideways because he feels his arms block him from the negative energy. John has untreated diabetes and high blood pressure. Despite our attempts, he has yet to see a doctor and has been untreated. Clients like John can be difficult to engage and hard to treat. They typically wait to receive care until their chronic illness has reached a critical level. At this point, care is expensive and outcomes are poor. SMI clients utilize much more of our resources. By providing services while clients will access them, this pilot will improve overall health while saving money. This will not be easy. As I shared earlier, the issues are complex. Someone with a serious mental illness is nearly 4 times more likely to die from heart disease or diabetes, or 5 times more likely to die from respiratory ailments. We have to provide client-centered care to change the health outcomes of these clients. Like John, many SMI clients have paranoia and anxiety. Imagine you're in a clinic with your child and John is sitting next to you. As the wait drags on, he starts pacing and maybe talking to himself. He becomes more agitated by the minute. How comfortable or safe would you feel? How comfortable or safe do you think John feels? Say John does make it into the doctor's office. By this time, his thinking is disorganized. He can't explain to the doctor what's going on with his physical health, or the doctor hears his many symptoms and discounts them to his schizophrenia. Both ways, John leaves the appointment without the care he needs. This pilot flips the model by embedding physical health care into the mental health center. The model uses peer support partners to meet with the clients prior to the visits, helps them identify 3 to 4 issues they want to talk to the doctors about, attends the visit with them to help reduce anxiety if the client chooses. They also follow up with the clients to help coordinate any additional visits. This model moves from just being co-located to providing integrated care. The mental health center will share information with the clinic, and the clinic will share physical health care information with the center. Staff from both agencies will attend the morning huddles on primary care clinic days to ensure the full needs of the clients are discussed and addressed. Now imagine how John's experience will change. He doesn't have to leave the safety of the mental health center to go someplace unfamiliar to get treatment for his diabetes and high blood pressure. The peer support partners reinforce his upcoming visit with the primary care doctor. They even walk him to the clinic suite to show him around prior to that visit. The outcomes from this pilot have the potential to influence how SMI clients receive care in the future. Under the direction of Kim Bond, President and CEO of Mental Health Systems, and Judy Chaplin, President and CEO of Mountain Health, a steering committee was formed. The steering committee is comprised of each agency's chief operating officer, chief financial officer, and chief medical officer. In addition, an implementation committee was formed. This consists of members of the steering committee along with representatives from each agency's IT departments, facilities, finance, human resources, and clinical operation departments. Alliance Healthcare Foundation's funding will cover mental health systems peer support partners for care coordination and designated space. It will pay for Mountain Health's increase in staff time for longer initial visits expected to be 1 hour. The pilot plans to start seeing clients this month and will serve 240 clients in year 1 and 480 clients by year 3. We'll measure our success by looking at how many clients complete their exams, take their medications, access preventative care services, are referred to specialists, and decrease their use of emergency rooms. In addition, Alliance Healthcare Foundation has signed a contract with UCLA for an independent evaluator of these outcomes. Oops. This independent evaluation will be essential to the sustainability of the pilot. We hope to leverage results to receive ACA Health Home funding, which will include reimbursements for the use of peer support specialists for care coordination. This pilot is being built in a way that it can be shared with other providers throughout California and nationally. As mental health systems and Mountain Health come together to create a health home for those living with serious mental illness, we do so knowing that the stakes are high. We thank Alliance Healthcare Foundation for their funding and will be sharing results as they become available.
Good job. Thanks, Scott. So what was exciting about this project for us was taking the status quo and really turning it upside down, taking a model that everybody was trying because it seemed like the right way to go about it, but recognizing that there was a population being left out, the seriously mentally ill. So we're excited about seeing this project come to fruition, to get off the ground this month, and look forward to working with them to prove this model successful. So I hope that you have learned a lot from these presentations. If you know of someone who might be, who's not here today, but you think would learn a lot from knowing about the Innovation Initiative, please let them know about the forums that we are going to be hosting. Those are on the back of your program, the dates, but they are coming up. The first one is tomorrow at 1 o'clock. And the second one is Monday at 9 o'clock. That information is on the back of your program. Please let others know about it. I'll be mostly going over the application and answering questions specifically about ideas that people are coming up with. We won't be repeating all of these presentations, but hopefully if you know others or if you want to get more information, I'm going to go through the application in just a minute. But if there's others that you think might be interested, let them know. Next, I want to bring up our program officer, Michelle Silverthorne. I can't speak right now, to let you know about our other grant opportunities. Many times we just focus on one particular grant cycle that we're working on right now, Innovation Initiative. But I think when we have other people in the room, it's really good for you to hear about some of our other grant cycles that we have. So, Michelle?
To join the rest of the So welcome all to our second iEngageU forum for this year. So I don't know if you've seen this. Has anyone seen the iEngageU, heard about it, maybe attended the one in February, the forum that we had? Was anyone out there at the Health Literacy Forum? I was there. So this isn't, the programming that's behind iEngageU isn't exactly new. Some of it is work that we've already been doing, but we're adding some other pieces to it. And some of that is the forums that we're doing. And so this is an effort for us to learn about what you're doing and kind of take those pieces of information that are happening in the community, but might not have a forum to discuss what's happening with their work. So with the Health Literacy Forum that happened in February, CHIP, along with Health Literacy San Diego Council on Literacy, updated the Health Literacy Plan. So the forum gave them an opportunity to talk about the findings and the implementation of the plan. So in addition to the event today, the one we had in February, we'll have 3 other events this year. So our next one is in June. And that one will be on community health and wellness and building connections and strategies. So look for those other events that'll be coming up, like I said, in June. And then in September, we have one on food systems, and then in December on mental health. So that's one piece of the iEngageU forums. The other piece is something that we've been doing all along, and that's the grantee learning opportunities that we provide. So if you are a Alliance Healthcare grantee, we offer social media workshops or other different other webinars that might come up throughout the year. We have CEO ED exclusive events as well. And so in addition to these events that are community, the learning that we do with our grantees, we thought, why stop there? We share a suite with two other organizations, California Endowment and San Diego Grantmakers. And so we decided to continue to advance health and wellness in our offices as well. So a couple of weeks ago, American Diabetes Association came in and they talked with us about health and wellness, and they put us to a 30-day challenge to take one of 9 things to do for the next 30 days. So I decided that I'm going to eat 4 to 5 veggies each day. So making sure that I'm getting my veggies in. Nancy's making sure to move every 90 minutes. So just doing some other things in our offices as well. And that all falls in the iEngageU. As well, there's been a hashtag. Have you guys been using it? The iEngageU hashtag? I know you guys are all social media. Like, you're all on there. Everyone is. So go ahead and use that hashtag. And we have it here. There it is. So, and just about for today or any of the other forums that you might be attending. So that's a little bit about iEngageU in the forums. But the other part, does everyone know that the Alliance has 3 different grant cycles? Is everyone familiar with that pretty much? Okay. So Alliance has 3. You're here for the Innovation Initiative, and then we have the 2 others. So I'm just going to go briefly over mission support and responsive grants. So our mission support grants are core operating grants, and those range from $25,000 to $100,000. The grant opens in the fall, and we just announced our 2016 grantees in February. So like I said, it's for core operating expense. And when the grants come in and they're being reviewed, these are the types of things that we consider with them. So first off, that the organization is advancing health and wellness, that their mission aligns with our mission. As well, is the organization embracing innovation? Is there that approach in their work? And then the populations are the most vulnerable populations that we look at. The poor working poor, so under 250% poverty, homeless, children, and uninsured or underinsured. And we fund in San Diego and Imperial Counties. So this is our 2015 grantees. We had 29 mission support grantees last year, and they worked throughout San Diego and Imperial County, in overlapping in different parts of San Diego County and then also into Imperial. And this is just an overview of what 2015 grantees, where they worked in the vulnerable populations that we focus on. So 24 in poor, 2019 in uninsured and underinsured, 17 with homeless, and 19 with children. And to learn more about our 2016 grantees, this is a screenshot of our website. So if you want to learn about those organizations that were funded this year, you can just go to our homepage and you can see who was funded. And the other grant opportunity we have is the responsive grants. So this one is open year-round, and we request a 2-page overview of the project. And these are the criteria that we look at when considering responsive grants. And one thing to think about is that it is a truly responsive grant. So it's something that is that immediate need, something that that you didn't expect was going to happen, maybe, and as well as these other points. So it's up to $25,000. It doesn't have to be $25,000. It can be $3,000. It can be $14,000, $525,000. Wait, not that many. $5,000. So up to $25,000. Time sensitive. It can be a co-funding opportunity or a novel funding opportunity. It can support leadership or organizational development. And the last one is support for a community event or activity. So you might see Nancy and I out at fundraisers or galas, and this is where the funding comes in to support those organizations. So a few examples of responsive grants. The first one being time sensitive, so Mama's Kitchens. So Alliance Healthcare doesn't work in appliance repair, right? So we didn't go in and say, we're going to fix these ovens. But the work that Mama's Kitchen does is they prepare meals for HIV clients. So without their ovens, they can't do their work. So they can't continue to advance the health and wellness of their clients without the ovens. So the ovens were a responsive grant from Alliance. Organizational development, I talked about CHIP a little bit and their health literacy plan. So the health literacy plan impacts the access and level of care that a client might receive, and it also helps doctors deliver better care as well. So that's how it impacts the health and wellness. And then the novel funding idea, San Diego Impact Investors. So this one kind of seems maybe, how does this align with health and wellness? But they're working to solve social problems in different ways, in innovative ways. And so they're working on, they're working with the Unreasonable Institute, which I think is a great name. So they're working with Unreasonable Institute to develop an impact incubator model, and they're going to be emphasizing health and wellness for the outreach, education, and entrepreneur track of that model. So those are a couple examples of responsive grants and a little bit about mission support. So I'm always happy to talk to anyone, go out for coffee, go to your organization and meet with you if you have further questions. And that's all I have. And if you have a couple questions now, I'm happy to answer them as well. If not, Nancy will get right into the innovation initiative.
All right, thank you. Thank you, Michelle. In an effort to try to maximize our resources, I have Michelle take on most of the mission support grants. I take on the innovation initiative grants, and we both respond to the responsive grants. So, but you can't go wrong with getting in touch with either one of us, and we'll help you out, whether it's by phone, email, or coming out for coffee, meeting you at your place, meeting you someplace else, taking a walk, getting in that moving every 90 minutes thing. But now I'm going to walk you through the Innovation Initiative application process so you know what you can expect. Those applications open up today. They will be online for you to take a look at. And they are due back on May the 11th. So you have about 5 to 6 weeks to complete the applications. So you're probably wondering, what are your chances of getting an Innovation Initiative? That's why we handed out these 8-ball pins. So if you have yours in your hand and you, I don't know, click it a few times and then see what it says. Ha, I'm absolutely going to get one. How about that? So anyway, so what is innovation to us? Innovation is really looking at something that's a systemic change that prepares for the future by doing something different. It reduces costs, it improves quality, and/or it increases capacity, and it uses data to support that plan. I think you saw today and heard from the presentations today some really great examples of the variety of types of innovation that we are looking to support. Where must it affect? It has to affect San Diego and Imperial Counties and the communities in these 2 county areas. That said, the organization may not be based in San Diego. In fact, when I talked about One eApp, the organization that was running that particular project was not in San Diego, but the work had to be done here in San Diego and/or Imperial Counties. What was interesting about that project, and one of the things that we learned, is that there has to also be a good partner that's here in San Diego, because having a local champion is very important to the success of a particular project. But the qualifications are that you are a 501c3. If you're not a 501c3, having a funding fiscal agent that is a 501c is imperative. If it's outside the organization, outside the 2 county area, you partner with somebody here, and preferably the work is fully implemented within 3 years. As you can see, that process is varied depending on the type of project that we're funding. There's a lot of demographic data that we ask for. It's kind of the standard stuff. We got to know who you are, how to get in touch with you, that kind of thing, as well as some of the financials that we want to see with regard to your organization. Now, sometimes very large organizations want to know, is it the whole organization or is it just this project? And sometimes that's a conversation that we should have to understand what the impact is, because sometimes knowing the full organization's ability to support the project is just as critical as knowing what the project's ability, what the financials are for the project. You do have to target one or more of our target populations. The 2 broad ones are the 250% of poverty or below, as well as the uninsured or the underinsured. More specifically, we also look to how we can be a voice for those that don't have a voice in the children and the homeless. But again, under the whole umbrella of advancing health and wellness. We'll ask you to tell us a little bit about the population that you're trying to serve, where you're going to serve. We also like to understand kind of the breadth. So you may not be in all of the areas of San Diego County, but you might be in a few, but you're going deeper into that community. I'm going to focus on the next 8 questions because they are really the most critical part of the application process. Yes, all the other stuff is a need to know, but this is where it can make or break your project. This is where if you have any questions, please do not hesitate to email me or call me so we can talk about what your questions might be. So the first one is, what is the problem you're trying to solve? How do you know it's a problem? Sometimes it can be compelling stories. But what is the value proposition that you bring to this particular project? What is the value you're bringing to the people that you're trying to serve? Why do they need you? The second question begins to address your solution to the problem that you identified. What is the impact of this solution? What do you hope to accomplish? And again, why you? Why your organization? Do you have competition now in this particular area, or is it very new? If it's really new, where is your new competition going to come from? And sometimes it might not be the norm. There was one project that we were talking about that was looking at what were the other nonprofits that might be a challenge. When in fact, when you looked at their social enterprise that they were trying to develop, it might be more for-profit organizations that were ultimately the competition, not the nonprofits. And it's always great if you have any kind of market analysis. We know that that's a difficult hurdle to kind of meet, but it's one that if you have that, it's great to know. How do you know how many people need your service? And what percentage of that market do you think that you're really going to reach? The third question addresses your innovation. What are the key elements of your project that are innovative? Sometimes I see really creative uses of current ideas that may not be innovative. So you have to explain to us why you see that as innovative. How is this project really different? I think as you saw the presentations here today, you could see those elements that were really different, something that you might not have thought of. The fourth question is the composition and the structure of the innovation. This is where I think you've heard me say it maybe 2 or 3 times today already. We're looking at how you're going to reduce the cost of the care or the service that's being provided currently. How are you going to improve the quality of the care or the quality of the service that the people are receiving? And or how are you increasing capacity? So in what you're doing, you're going to enable more people to be served or more people to get the product that you're producing. I always get ahead of myself on my notes here. Project leadership. I can't tell you how important this is. It's great to have a leader who has been with the organization for a long time, but sometimes a new leader who brings fresh ideas and has a long, extensive history and experience in the field of what you're trying to create because it's new and innovative is also a plus. What I've seen in the presentations is when the leaders have the passion and the dedication that just exudes from every pore of their body, because that convinces us that they are not going to let this project fail. The other is really looking at what are the skill sets you need to bring this innovation to fruition. Sometimes when we're funding a concept, or sometimes when you're looking at a product that it really is innovative, you might need a whole new set of skills. You might need somebody that knows retail marketing. You might need somebody that knows how to do a particular skill set. And if you don't have that right now, how are you going to bring that in with the funding that we provide so that we know you're looking at all of the skills that you need to make this particular project successful? And this one is probably one of the most difficult. And what is your sustainability plan? You're going to have your startup costs. You're going to have all of the implementation costs. Our funding hopefully gets you to implementation in 3 years. And then what? What is this project going to do to really be able to sustain itself beyond our funding? Now, as you saw, there are also examples where we believe in the project, we want to see it to fruition, and we continue to give it funding. That may be a possibility. but it may not be. You can't bank on that. So what are you going to do to help ensure that your particular project is going to go beyond what our funding provides? This one kind of goes along with that. And then what is the plan to scale the project? Many times it's great to start off small, right? And to test this model and to tweak it and to make sure that it's going to work, because the plan is to bring it to the rest of San Diego County, to bring it to Imperial County, to bring it to the state of California, or it's such a great project that it could go nationwide, worldwide. But you can't start at the world. So where do you start and how do you get to where you want to go? And what are the expansion plans for that particular project? Last but not least is the budget. And I always tell people that even though this is $1 million innovation initiative, we want to see your true budget. We want to know what we're getting into. Is it really a $3.4 million project? We want to know that. I'm probably going to be more suspicious of the project that comes in at $999,999. That's incredible. So it may be $700,000. It doesn't have to hit the mark of $1 million, but the $1 million is the challenge. If you had $1 million, what would you do? If your project is so innovative that it takes more, we want to know. We want to know whether we're going to be on the hook for more funding, but because we only are going to give you $1 million, what are you going to do to get the rest of the funds that you need to make the project viable? So it's a real challenge to you to give us not only the true costs, but also your plan for covering those costs if we don't go beyond $1 million. And I can tell you that this is really a very different way of presenting a project than your typical grant. We have if you make it to the top 5 that are going to present before the board, we have a consultant that works with those groups to really help them prepare for their presentation. And he always tells me that the first day he sits down with them, he says, tell me what you're going to do. And it takes everybody about an hour and a half to tell them what they're going to do. And he says, okay, you have 15 minutes. Now what are you going to do? So it's very different to be able to boil down to the very core of what this project is. And what I try to advise people is that if you make it to the top 5, you've already got us at the heartstrings. You really don't have to talk about the heartstrings. We know that. We believe in you. You align with our mission and we love it. Tell us why your business model is going to work. Tell us why this project is going to be viable. Tell us why you think the community is going to adopt it, right? Those are the real challenges in this particular part of the business planning process. So what would you do with $1 million? We really do want to know. So I'd like to open it up for questions. And Michelle, if you want to come back down and join me, maybe you, instead of like hiding or creeping or trying to find out what's happening with the live stream. I forgot to acknowledge the live stream. Hi, everybody. I'm so glad you joined us. But anyway, questions? Y'all are all going to call me, aren't you? Okay, it's all right. I'll be there. Yes, question. Yes, it is all on the website. The application process is opening up today, so you'll be able to access that. Once you start the application, you can run through it, but you can save it and not have to fill it out today and go back to it when you're ready. There are the webinars. I'll go through these same things. Yeah.
It closes on May 11th, too, so you have from now
We can
until
always,
May 11th.
yeah, repeat that every chance we get. May 11th. Any other questions? Yeah, Don, excuse me.
What's the decision-making process and who are the decision makers on the grant?
It's all a secret. Transparency is overrated. Just kidding, just kidding. We usually get in about 20 to 25 applications every year. I review them to see if they are at the level of innovation that we're looking for. Oh, they want me to do the mic because this is live stream and I'm so sorry. Okay. So we have about 20 to 25 applications that we get in on an annual basis. I review them first to see whether or not they are at the level of innovation and mark them as such. The program committee, which is made up of 10 members, both board and non-board members, review all of the applications. We have staff recommendations and notes that go along with that, but then they look at them and pick 5 of the applications to go forward. At that point, those 5 are notified that they will be working with the consultant, and they typically have about 6 weeks between the time that it is determined which 5, which is at the end of May, which is when the program committee meets. They work through with the business planning consultant, and then they present before the entire board, non-board members from the program committee, as well as a blue ribbon panel of experts from the community that all hear the presentations. At the day of the Pitch Fest, they present. They have 15 minutes to present. They have 15 minutes where they answer questions from the blue ribbon panel and the others that are participating. And then they leave, and the board and the blue ribbon panel and other members discuss the project, and we move on to the next one. At the end of the day, we spend about an hour with the blue ribbon team giving feedback. And then once we get that feedback, the blue ribbon panel leaves and the board talks about it themselves for another hour or 2 hours, and they make a decision on who to fund. That meeting is in July. You're welcome. Ian.
So last year at the training event, it went a little bit different. We had a lot of breakout sessions and spent a lot of time kind of identifying from the grantee level what we kind of thought would be markers to identify a good grant or a qualifying grant. Do you have any thoughts kind of from last year going into this year, if there are specific elements that we should be thinking about? You know, like collaboration was a big one that came out last year, using technology. I know we've seen what a lot of the former grantees have put forward, but are there any thoughts that you have and things that we should really be focusing on?
That's a great question, Ian. Actually, the board believes that you guys in the community know what's best for the community. And so we don't try to prescribe, this is what we're looking for. We want to see more collaborative effort, or we want to see in this particular disease area. We try not to prescribe that. We try to say that this is the type of innovation that we're looking for. And as you can see, there's a broad range from aquaponics farms to squash courts to, there's a broad range. So we don't want to prescribe it and say, this is what we think is best for the community. We really want to hear from you about what you think is best, what in terms of the people that you're serving. And to the degree that you can bring in the voices of the people that you're serving, that's really important too. Does that answer the question? Yeah. Any other questions? Hearing no, oh, Rosemary, oh, a board member, she's gonna try to stump me.
In looking at many applications over the years, it seems to me people work very, very hard with the first question and the second question. By the time you get to sustainability, it's very, very difficult to present something that's meaningful to us. But as Nancy said, and I think Michelle did too, we really need to know about your sustainability plans. Even it doesn't work out. You're thinking about it, you're planning, and you're also obviously interested in help.
Thank you for not stumping me. Good addition. All right.
Someone else might have that same question you're thinking about.
Exactly. That's okay. Call me. Call me, send me an email. I'd love to talk with you about your projects. There's many times that I've talked with people about their projects and given them some feedback about how to really beef it up and where there might be some things that are missing. So please feel free. Don't think, oh, she's so busy, I can't do it. I really want to help you be successful, so please reach out if you do have other questions. Thank you all for being here today with us.